Good evening, everyone. I'm Karen Friedman Quinn with the Programming Department here at Wilton Library, and I'd like to welcome you to the second in the series called The Sandwich Generation. And tonight we're going to be speaking about local lifelines, local help. So it is specific to Wilton and surrounding area of about 5 or 10 miles at the most. And we have a panel of 3 local experts whom Paul Doyle, who's with Oasis Care Advisors, will introduce to you after I'm finished with this introduction. I'd like to let you all know that the Wilton Library will be introducing what's called a memory cafe here at the library on May 20th. A memory cafe, if you're not familiar with the term, is a place where people who are having cognitive impairment of some kind, dementia or Alzheimer's, can come to join a group of people who are in their same situation, along with caregivers. So it becomes a social group. It becomes an outing for people whose lives have become much smaller in scope since their diagnosis. And we are planning activities for the group. There will be refreshments, activities, and time for caregivers and the dementia patients to bond together, as well as bonding with other caregivers who are here. And hopefully it will serve as a resource where people who are on the same type of journey, whether as the person or as caregivers, can share uh, hints, help, support with one another. So there's only one other of these types of groups currently in Fairfield County, and that's taking place up in Ridgefield. So we're very proud to be the first library that's actually going to be doing this in a library here in Fairfield County. Uh, this is something that is memory cafes have been in existence for about 25, 28 years. They started in the Netherlands and then spread throughout other countries in Europe, and then in the early 2000s made their way to the United States. But even though they did make their way, there are very few of them that are around at this point. So I hope that when the announcement, the formal announcement comes out, that you, if you are a caretaker with someone who is on this journey, that you'll sign up with them and come to the Memory Cafe for a little lightheartedness and a pleasant hour. We're going to do this once a month, and you'll see plenty of publicity about this. You'll be able to call me directly to register. And the one thing you just have to keep in mind is that this is not a drop off program. This is a program for the person and their caregiver. So I hope if you're not in a position to take advantage of this, that you'll tell some of your friends or people you know who may be able to benefit from this program. So with that, I'm going to turn it over to Paul Doyle, and he'll get the informational part of this program started. Thank you.
Thank you, Karen, and welcome. I would say, just to follow up on those comments about a memory cafe, if you're not familiar with it, pay attention to it comes out. It is a terrific program, and the fact that your community is establishing one, it's another great resource, and that ties into what we're doing here today as part of the Sandwich Generation series. Now, the Sandwich Generation series was born out of the work that we do at Oasis, which is to help families navigate senior care. And that means the whole spectrum. So somebody may need a grab rail in a shower and some guy who won't screw up the tile. Somebody else may need Medicaid planning to get into skilled nursing and have Medicaid pay for bills and everything in between. So that's how we spend our days, is educating families on the resources that are out there. And every one of the panelists we bring in this series are people that we refer families to. So we thought, what a great idea it would be to just get them all together, and let's do this in a group setting. Good to do it one-on-one, and we're happy to do that as well. But this starts it. And so tonight we're going to be talking about local lifelines. We gave last month was a primer, 10,000-foot view of the whole spectrum. It was videotaped, so if you want to go back, it's a good cheat sheet. It's a Monarch notes of the whole thing. I think you'll find it valuable. In subsequent weeks, and I'll go into this later, we'll break it down, and we'll bring in lawyers for the legal piece. We'll bring in home care and durable medical equipment people for what to physically do in the home. Tonight, we're going to talk about local lifelines. So these are resources that are available right here. Some have small membership fees, but a lot are paid for by federal and state monies, and these are programs that are there for you. What we're trying to do is expose everybody in the community to the resources that are available to them, and to get people talking. Okay, don't wait till a crisis. That's what you'll hear in every single one of these. Don't wait till a crisis. So remember who you hear speaking tonight. Keep them in your Rolodex. Reach out to them and go deeper into what you need. So with that, let me get started. On my far right is Lisa Roman, who has been on the board of Stay at Home in Wilton for 5 years and vice president for the last 4. Before becoming a board member, Lisa was a volunteer with the organization. And like many in the senior space, Lisa had a situation with her mom where she was introduced to the need for services and resources and became aware of Stay at Home in Wilton. She has a certificate from the Encore program at the University of Connecticut. To Lisa's left is Lauren Hughes. Lauren is a licensed clinical social worker with a master's degree in social work from Columbia University School of Social Work. Lauren initially worked for several years in hospital settings in New York City before taking time off to raise her kids and do volunteer work until the day her son got her driver's license and she applied for a part-time social work position at the Wilton Department of Social Services. That was 31 years ago.
Old aging in place.
Yeah. I love that. Lauren has been coordinator of social services and family programs for the Social Services Department since April of 1994. She also has a private therapy practice in Ridgefield. Lauren was instrumental in developing the Wilton Food Pantry and is involved in Medicare counseling throughout the year. Lauren has 2 adult children, 6 grandchildren, and when she is not at work, she spends time with her grandkids, gardening, and to Lauren's left is Katie Regan. And she has been a social worker in the social work field for over 20 years, specifically working with the senior and disabled population. She resides locally in Seymour with her 2 kids. Did you say 11? Yeah. If my numbers changed now, it's not 10 and 12, we're 11 and 13.
11 and 13.
And her spouse, in addition to being a working parent, she also was a primary caregiver for her grandmother, so she knows firsthand the vital role that caregivers play and the importance of community service, community resources. It will also say in all three of those biographies, which came from each of them, you notice one commonality, that they all faced it in their own family. So it touches everybody. What I'd like to do to start us is, I want to hear from professionals about the signs that they see that their clients and the families that they deal with don't react to, that they see that maybe this should be the catalyst rather than waiting for a crisis. So I think if I'm waiting for the crisis, what are the types of things we see that maybe should raise a red flag that doesn't?
I know in our group and with our members, is the first thing that kind of claims your independence is ability to drive. And that's something that we kind of face, and that's why one of our main services is transportation. And sometimes that is over 600,000 adults lose the ability to drive every year for whatever reason. And which is for many people a lifeline, whether you're going to the doctor, you're visiting family. And so it's a huge, huge proponent, and unfortunately can lead to a lot of loneliness and isolation. And that, I've heard, is almost like smoking 16 cigarettes a day. But so if there's any way that, our services really help kind of at least be able to have people go to the doctor, social functions, because you don't always want to call your neighbor. You don't always want to, bother your family. And so at least we offer a way that we have a concierge driving program. We go with our members to the doctors. We stay with them, maybe do a side trip to the store, whatever they need. But that's so important, because once you lose the ability to drive, it's really a lifeline to the community.
So do you see, that's obviously a big factor. Nobody says willingly, I'm done.
Right.
It's a traumatic thing.
Oh, it is.
How do we know, though, that we should be thinking about it?
It's difficult. Some people need a little nudge. I know when my mother was going through this and she went to the DMV and she was having an eye test and my sister was going to help her, I literally put her in arm lock and I said, go away. I said, let the DMV do this for us. It will be a blessing. And so that worked out, but it's little, unfortunately, we don't want that major accident. We don't want the major fall. We don't want any of that to happen. So it really does rely a little bit more on the family. We can see members and kind of, it's not really our job to do that, but we can recommend, and we would call the family, basically.
How about, what are some of the things we might see in the home? If I'm the adult son going into my mom's house, and what are things that might indicate that things are not, she's good, but I should start thinking about things. What am I going to see in the house?
Sure. Hi, everyone. Good evening. I'm sorry, I forgot to put in my bio where I'm from. Actually, I was focused on my kids and my own role in caregiving. I work at Southwestern Connecticut Agency on Aging. Some of you may have heard of SWACA before. We're based in Bridgeport. We're a not-for-profit organization. We're state contractors, so I am not the state of Connecticut. However, we administer a number of the state and federal programs for seniors and younger disabled in lower Fairfield County. So we cover 14 towns from Monroe, Trumbull, down to Greenwich. There's 5 agency on agings in the state of Connecticut. So, and again, we cover this neck of the woods. So just back to your question, I mean, for the son or daughter, who's visiting mom, and we get this call a lot, it seems like around the holiday times, for children who reside out of state, come home for the holidays, and maybe they're noticing that, one of the big calls we always get is that maybe, they open up the fridge and there's a lot less food in the refrigerator. Some of the food may be expired. Maybe they notice that mom or dad, was always, dressed appropriately, and now they're not dressing appropriately for the weather, or they're seeing that mom and dad are, wearing some of the same items that they wore in past days. They may notice that their house is a little bit more unkempt, or things are just disheveled. There's a lot of, notes going on places. So picking up on the small things, I always say, in the beginning, and kind of having your eyes open to what's going on. I think that just, as you were saying earlier, the main thing is to kind of try as best as you can to get ahead of it, because unfortunately, all too often, we do get a number of those phone calls where it's an emergent situation, and then the loved one is always saying, I saw things going on, but I was too hesitant to speak to my siblings about it, or speak to my loved one about it, and try to be upfront. And now it's an emergent situation.
Now, Lauren, when we spoke last week, you brought up the dreaded H word, hoarding. So
Which is now called a high content home.
Oh, okay. And look, this has been, it's almost a parody of itself, as serious as it is, because we put it on television as the most extreme. But that's not always what, we're not looking for the most extreme. So when you go into a home, where does your radar go on that we're either there or we're getting
Just to
there?
be clear, Social Services Department, we do not go into people's homes unless somebody calls and invites us to come and have a conversation with them. Unfortunately, usually the way we get involved is if EMS gets a call and the fire department and the police and emergency services wind up at someone's home and find access to the home is restricted because of high content. And the reality is there are some homes locally that look like, I don't watch those shows on TV, but what I've heard about them, where people live with so much clutter in their homes that they have literally passageways where they can walk, and where I think one of the definitions of the problem as a diagnostic issue is if the room or the facility is no longer able to function in the way that it was designed. If you can't cook on the stove because it's filled with mail from a year, if you can't use the bathtub because it's become a storage place, if the bed is not able to be slept in because there's so much clothing on the bed that nobody could lie down on it. And there are situations like that, and it's a very difficult problem to address and a very difficult problem to remediate. But we do become involved because of the safety issue. Now, the extension of that problem is that there's usually a report made to the housing department in town, and then social worker often goes out to visit the home with someone from the fire department and the housing department. But again, without an invitation into the home, nobody can go in. So, the problem is often quite intractable. But there are lesser degrees of that problem. As Katie was saying, if children come to visit, if a neighbor sees there's an issue, if they're noticing that the mailbox is overflowing and nobody's come out to get their mail for a while, we will get calls from neighbors. And again, we often say, if you're making a referral, you have to ask your neighbor to give us a call, to give us permission to come in and help them. And then we try to get them to come in and see us, or if they invite us, we might go out. We don't really make house calls.
Okay, that's great. So that sets us up. So I've seen dings in the car, or maybe the side view got clipped. I went in and the milk was expired from 2 months ago, or there's stuff sitting on top of the stove, so we really can't cook. Or the bed, that's a really common one, right? The bed, you couldn't sleep there, or you're sleeping in a really tight. So that's got me engaged now. Now, where do I go? And that's where you guys are here. My first step is going to be, so let's drill down on each of the organizations, because they're different. They work in concert with each other. But let's get into that a little bit. So Lisa, let's start with staying at home, because I think that's an interest we were discussing before. I think it's an interesting one because it might be the least reactive. That, this is like,
Well,
joining,
yeah.
it's joining a
Joining a
club with
social
circle.
fun club.
Right. So tell us a little broadly about
Okay.
and touching on this. I'll make sure you touch on the points that jump off on me.
Okay, I'm not sure if everyone is familiar with Stay at Home in Wilton. We are celebrating our 15th year here in Wilton. But we're part of a larger group. We're part of the Village to Village Network, which was started up in Boston in Beacon Hill, where a bunch of neighbors in a apartment building kind of relied on each other to help, and realized that the more help they had, the longer they could stay being independent and living in their own apartments. And out of that, it grew the Village to Village Network. And now there are over, I say almost 300 villages between the United States and overseas. We have counterparts in Darien, New Canaan, Greenwich, and all in the area. So we handle Wilton. We've been here for 15 years. And our goal is to really help people, in small ways to be able to stay, in their home, stay engaged in the community, stay safe, but also connected. One of the statistics that I read is that basically 1 in 3 adults older than 65 live alone. And when that becomes 85, half of the population are living alone. And so, as I touched on before, loneliness can be a huge detriment to your health. And so what we do is we try to bridge that connection. And we have, not only do we have our driving program, which is really important, we have more social and more educational seminars. We've collaborated with the library on here on certain programs on how to fall. We just had our local political folks in talking about different things. We did a whole program at the Y talking about, how do we keep moving and staying fit? And we do have others planned. We've worked with the police department, the fire department, talking about scams, talking about finances, talking about anything that we think would be of interest, nutrition, cooking for one. How do I, navigate a store, looking at labels to stay healthy? And we're going to be doing one with the Humane Society, because as we're aging in our home, we're aging in our home with our pets, and that's another whole scenario. So we're addressing that too. And then the fun part is we do a lot. We have 2 of our members sitting here in the front row. Is we do have a lot of social. We just want to be connected. So we do an ice cream social in February. We're coming up with our 15th anniversary party at Ambler Farm. We do another program of barbecue in the summer, Thanksgiving potluck, Oktoberfest, and then we do a big holiday party. So it's a lot of staying connected with friends, talking, chatting, getting dressed up, getting out of the house. We'll do some trips, local trips to lunch. We have a men's breakfast at Orem's. We have a very active walking club. And so we try to do as much of that to get people engaged. But then on the other side, as we meet with people in transportation, if people do have issues in their home, we have call it a handyman or in-home services, just for little things, changing light bulbs, making sure there's batteries in your smoke detectors, small repair jobs, maybe moving furniture, moving some of those boxes or things around. And also, if something is a little more dire and you need a professional, I know that some people are afraid to have, strangers come in their homes. They're afraid of being taken advantage of by, different people. And so we will recommend, whether it's a plumber, electrician, or whoever, and help out as many of the little little projects in your house, and help. We had the ice hockey team shovel walkways for our members and try to engage as much also with other generations, because the 2 loneliest generations right now are teenagers and seniors. So we try to bring them together in different ways. And light errands, if people need help shopping, outside of going to the doctor, go to the pharmacy, really whatever that people would need, that they want to stay and can stay in their house, before it gets dire. At that point, then, as I said, if our drivers notice something or we notice something, because we will go in the house if asked, whether we're doing something, to help or carrying groceries, and we notice something, then we'll either call you or maybe start with a family member to say something is not right. And so that's kind of where we're like an entry kind of organization, but we're all about keeping people connected and engaged, both on the social sides and also keeping you connected through transportation, and then start looking at your house to make sure that it's going to be safe, and if you need some small repairs, and then can make some recommendations for some other repairs. But that's kind of where we kind of, get people. And people will say, it's like, oh, I'm not old enough for your organization, but actually in Wilton, it's very cool because when you move to Wilton, you have the Newcomers Club. Remember, we all joined that many years ago. And then they have the Encore Club, which is another kind of social thing. So we're like that next step. So it's a nice progression because we have crossover members, both not as much the newcomers, but definitely the Encore and this stay at home. So it's just nice. And when people get together and they just want to sit and talk with other people, feel connected.
Right. And I love the little services are hugely important for keeping independence.
Oh
The
yeah, because
the
if
shoveling, the light bulb and the chandelier that's out, that the house has gotten dark.
exactly.
Fire alarm battery is out or beeping, so
Yep.
it just disconnected it. And you talked about it's an entryway. It's an entryway to problems.
Right,
And-
because you don't want any people going up on a ladder if they don't need to. You don't want anyone walking up a dark stair or an icy path. We also, one other important thing is we'll use some of our high schoolers is we also provide tech help, just kind of little things because everything is here. And one
Yeah.
thing that was interesting, I did a drive, one of our members to the doctor's office, and I get up there and the first thing the receptionist did was hand him an iPad. And he kind of looked at me and I looked at him and I said, let me help you with that. So it's just helping with some of these things.
Right. Okay, so let me move on. So Lauren, I know you work out of Comstock. I know senior centers at Comstock, but I want to focus on social services because I don't think that a lot of people understand the resources that are offered within social services. So what are the most valuable services that you're offering the residents of Wilton?
Well, I just want to say that primarily what we are offering is information and referral. When I get a call from a family member who is looking for help with housing or with care at home or with cleaning out the clutter, I get busy on the phone and tell them like who they can call to get help with those services. And I make a lot of referrals to the area agency on aging. But in-house, I think the most active help that we give is with Medicare and Medicaid. During the open enrollment season, we have a Choices volunteer who is with us 2 days a week, plus myself, and we help people check their enrollment to make sure that what they have currently will be the best for the next year. I help with a program here in October for people new to Medicare. Sorry, I'm never very good at this because I'm short and I'm not used to it. There's a program here in the library for people who are new to Medicare where someone from SWACA comes and explains all the ins and outs of the program, which are unfortunately very complicated. It shouldn't be, but they are. And from that program, all year long, I sit with people who are turning 65 and help them to enroll in Medicare. It's interesting how many people don't know that that's something that they really need to do. There was a time when people turned 65, they got retired, they went on Medicare, they got their Social Security. That's pretty much no longer the scenario. Many people are continuing to work and have coverage through their work, and they don't understand that they need to also enroll in Medicare and decline some of the services and enroll in some of the other services. Anyway, we help with all of that. And then there are also some programs in the state of Connecticut that help with paying for Medicare called the Medicare Savings Program. We help people enroll in that. We give people resources who need help with housing if they're no longer comfortable living in their home and they want to move to some senior communities. We have resources to help people get on waiting lists for those communities. And one of the things that I do personally is that I run a town food pantry. We have over 100 seniors who come weekly to the food pantry. We run on a grocery store model, so everybody gets a shopping bag and can go and get their own groceries. We don't pre-pack. And the only thing you need to qualify is to be a resident in Wilton and to come and say that you have some food insecurity and you need help with food, and then you're qualified to shop. We also give out Stop and Shop and Village Market gift cards, and if you want to qualify for that, people have to provide some financial information, but it's really pretty simple to get involved in that. you would be surprised how many residents in town have food insecurity issues. So we do have that. And I know Paul doesn't really want me to talk about the senior center, but I do need to say that along the lines of what was being said about socialization and interaction with peers, we have a really amazing senior center. And it's program based in that there are lots of activities. I left the senior center newsletter on the back, and there's a calendar inside. You can see all the stuff that goes on every day. But we have spaces where people can come and sit and we have coffee all day long, every day, and people can come and sit and have coffee after their programs, and there's a lot of that going on. All the programs are free for anyone who's a Wilton resident. So, you know, you can come and do yoga or Tai Chi or play bridge, or come and have lunch, and it's all paid for by, you know, it's all free to anybody who lives in Wilton. So, you know, and sometimes people just need to call up because they need to talk about a situation that's going on in their family with a parent or with a child. You know, we're always there to, you know, to listen to people who have issues and try to direct them to the appropriate resources. Aside from myself, who does the senior services, we have a counselor who does youth, who's involved with youth services, and then we have someone who's the director of the senior center. We'll have a new senior center director on April 7th, and we have a relatively new director of our department, Stephanie Rowe, who was the senior center director for several years. So, and we have an amazing administrative manager, Debbie, who usually is the first person that we meet on the phone. Oh, you're telling me I'm not, sorry. Anyway, if you missed what I said, you can come and talk to me afterwards.
Okay, I want to touch briefly though, because Lisa brought it up before. Transportation is a big piece.
Oh, right. I
Transportation
left brochures on the back. We have a great dial-a-ride service that runs anywhere in town, Monday through Friday, 9 to 4. I believe it's $1 each way. They'll take any Wilton resident anywhere in town for any reason, to the senior center to get a haircut, to the post office to pick up groceries, to go to the pharmacy to get your drugs, whatever you need. You just have to call a day in advance, and the drivers are wonderful, and they'll pick you up at your house, bring you to where you're going, and then bring you back home. They also go to Norwalk for doctor's appointments on Tuesdays and Thursdays. I believe it costs $3. And that's from 9 to 5, Monday through Friday. 9 to 4, Monday through Friday.
And you can talk about the senior center all you want. I want to make sure social services had the platform because people know a bit about them. On that senior center, we talked a little bit about just being out and being engaged. And I think Lisa touched on this. That's care. We're taking care of ourselves. It's not going to a doctor, but these are good habits for keeping ourselves. We go for a robust walk. We need to have social interaction, and these are the forums that are easy to have them because they're difficult to have.
And the other advantage of having a place where people come on a regular basis, both the senior center and the food pantry, is it gives the social workers a chance to interact with people, and we notice when things are changing. You know, it's because I've been here a long time, so I notice when people are getting less and less capable. I notice when they don't seem to be managing as well. And so just that the fact that we see people gives us an entree into noticing when things are slipping a little bit.
And the Medicare piece, it's not just about starting it. I'll tell you, we just had a case of this, and we got SWACA involved because we got a call from Greenwich Hospital because a gentleman who was 72 years old was in the hospital but had failed to enroll for Social Security or Medicare at 65. At this point, didn't have health insurance, and they couldn't send him anywhere. He couldn't go to rehab. There was no rehab that was going to take him because he didn't have insurance. They weren't going to get paid, so they just said, "Sorry, we don't have space." The other thing that we recommend to a lot of people, it's another habit. So, okay, that's good at 65 to do, but the difference between health span and lifespan is so great at this point in time that we have a long period. So when I retire at 65, my health needs, my care needs are one thing. They're different at 72, 79, 85, 92, and 100. And off of that, our insurance should probably change or at least be evaluated. And a healthy thing, like you take your car in for a lube once in a while, you should go in and see the choices counselors on a regular basis to make sure for your current health situation, is your insurance the right or the best insurance for that? You know, a lot of people get caught in with advantage in the beginning. It's a great deal, makes all the sense in the world. You start getting a little more active with clinical settings, it may not be the right solution. And you need to pay attention to that and sit with a choices counselor to pick out the right one. So it's great that you guys have that as a regular feature.
Yes, thank you. So, I'm sorry, can I touch upon that? Or did you want to?
Well, I'll let you get into it. I want to get into so now we bring in the state now.
Oh, well, state contractors.
And the state, as you can see, is this really Darth Vader-ish looking,
Yes, very scary.
threatening piece.
Well, don't talk to my kids.
So Katie, give me the primer on the Southwestern Connecticut Area Agency on Aging, SWACA. Never
Sure.
going to say the whole thing. It's
I know,
SWACA.
it's a mouthful. It's
Okay,
a
so
mouthful.
tell us about SWACA and what we should know about the service.
Sure. Gosh, I could be here all night, so I'll try to give the trailer version of it, the quick.
Well, I'll give you the points if you want. If you want to hit the. Tell me about respite. Tell me about
Sure.
respite. Tell me about home care. Let's start
Okay.
with those.
We'll start there. Sure. So, state of Connecticut and the federal government do have some programs specifically for seniors to maintain themselves in the community with supportive services, as opposed to prematurely going into a skilled nursing facility. Okay. In my department, the Aging Answers Department, we coordinate 2 of those programs. They're called caregiver respite care programs. They are programs specifically for individuals who reside in the community, need some type of supportive assistance. Maybe they need, some minor assistance bathing or dressing. I'm not talking like a sponge bath head to toe, but would it benefit them to have an aide there in the house, while they're managing their shower, to make sure that they're getting in and out of the bathtub safely, that they're drying off, that they're, again, they can put their socks and shoes on, but is it taking them 25, 30 minutes to do that? And it's so taxing, and then they're exhausted and have to sit for the next hour. Would it benefit them for that same aide to, make a light meal or strip the bed? I would love for somebody to change my bed sheets, and do the laundry. Would it benefit them to go to an adult day center potentially for some increased socialization and support? So again, under the caregiver respite care program, there needs to be that individual who needs the assistance, and then they need to have a caregiver. A caregiver in this particular circumstance can be a spouse. It could be a wife caring for her husband who has the beginning stages of dementia. It could be a child caring for their adult aging parent. It could be a neighbor who's, going over every couple days to make sure that their, neighbor who's a widow is, eating properly. Again, maybe they're helping them with some everyday tasks while the individual is taking a shower. It can be a church member. We also have caregivers who reside out of state. We have a lot of family members who, again, have moved out of Connecticut, but their aging parent still lives here in one of our 14 towns, but they're still a caregiver because maybe they're traveling here once a month to bring mom to her doctor's appointments. Maybe they're ordering Peapod for the groceries, for their loved one. They're managing all their bills. That still counts as being a caregiver. So under these programs, they are grant programs, okay? The federal government has a version, and then the state of Connecticut has a version. So we're able to go out to the home, do an assessment, meet with the caregiver, meet with the individual, and then if they decide that they want to come on to the program, develop with the caregiver a very individualized plan of care, okay? My grandmother, once she retired, she did not want to get up anymore at 6 a.m. She wanted to sleep and enjoy her rest. So for her, having an aide come in around 11 o'clock, that was most beneficial to her. Somebody else, maybe they are still a morning bird and they want that aide in there from 8 to 10, just a couple days a week to provide some of the hands-on care for their loved one so that they can tend to their own medical needs, or they could go to, a movie with a friend that they haven't seen in a while. So the caregiver respite care program, those programs are designed specifically really to relieve some of the stress, some of the potential burnout that a caregiver could be facing. Okay. These are grant programs. So when I say that, I always say these are kind of like essentially a stepping stone. Okay. These are smaller programs to kind of bridge the gap and to alleviate some of the stress until potentially someone can get on more larger based state programs. The state of Connecticut has a program called the Connecticut Home Care Program for Elders. It's specifically for individuals, again, in the community who need some supportive services. They have to be age 65 or older, and there are some financial requirements for the program. Everybody thinks you have to be on Medicaid only to be on this program. That is not true. There are a couple different categories. One of them, yes, is Medicaid to be on the program, but you do not solely have to be on Medicaid. A home is not considered an asset when you live in that home. A car is not considered an asset, okay? My grandmother, again, began with the caregiver respite care programs, and then as her needs became greater, I helped my parents transition her over to the Connecticut Home Care Program for Elders. She passed away in her mid-90s. The home was still in her name, okay? So she was able to get increased services from the Connecticut Home Care Program for Elders. Again, there's a care manager assigned to work with the family or the individual if they're directing their own care, again, to make that individualized plan. It just has a much bigger budget. It's just there to really provide more of a cushion, more of a supportive services for the individual so that hopefully if their goal and wish is to maintain themselves in the community, this could be that way to do it, as opposed to prematurely going into a skilled nursing facility.
Okay. Now, I want to talk about the position of SWACA and the state. We joked about it, but it's not really the state. But what it does is exactly what Lauren and Lisa's organizations do, is that they connect you with places. Okay, so Lisa has her recommendations for plumbers and things like that that are very useful. Lauren says she spends most of her time making referrals, or a lot of time making referrals. So tell me that you're not really the state coming in to take my house away from me. What is SWACA?
Sure. So it's kind of a loaded question. So what is SWACA? So, we're predominantly social workers, care managers. Again, our agency is not for profit. We are under the Older Americans Act. So we are a federal and a state program, and we essentially are state contractors. So all these programs that I just talked about, they are state of Connecticut or federal government programs. But the state will not go out to the house to do these assessments, okay? So they contract out to local agency on agings, and then we go out, we do the assessments, we work with the family members if they want to come onto the programs, but the state of Connecticut has the final say for some of these programs. So that Connecticut Home Care Program for Elders, as I mentioned, that my grandmother was on in her later years, that is a Department of Social Service program. They had the final say either to approve her or deny her to get access to that program. The care managers from the Agency on Aging helped my family do all the paperwork for the program, develop the plan of care for the program, how many hours the aide was going to come in, what time of day. And then the state of Connecticut was the one who finally approved it. SWACA also does have a number of private grant programs that we also administered. So not everything is just the home care program or the caregiver program. I myself coordinate a program directly with the VA. So I work with veterans who, again, are in the community, do not wish to go into skilled nursing facilities, but through the VA care are able to self-direct and hire their own aides. So through that VA program, I certainly don't know everything about the VA because certainly it's such a large system, but I'm able to connect a lot of the veterans to different resources and supports. We have some other private grant programs that we work with the Fairfield Community Foundation on. The list goes on and on. We do coordinate the Choices program, as you touched upon, in Lower Fairfield County. So, as you said, it's information and assistance. It's application assistance. It's helping those individuals navigate through the social service channels because, it's overwhelming. I'm not going to lie. There's a lot of paperwork sometimes for some of these programs, but we will sit down with you and go through the paperwork with you, make sure you have all the documentation so that hopefully when it gets submitted, it's clean and, approved.
Can we,
I just had a question. It's my understanding, and correct me if I'm wrong, that if I refer someone to you for the Connecticut Home Care Program for the elders, and you go out and do the interview and the assessment, and the state approves, then you have a contract with the home care agencies. Is that correct? You have a contract with the home care agencies, and you hire them and send the people to the homes? I mean, the client isn't responsible for that piece.
No, that's a great question. So SWACA, the Agency on Agings, do not hold the contract with the home care agencies. It is the state of Connecticut.
Okay.
So let's say ABC Home Care, I'm just making it up, applies to be a state home care agency. So we have to go through a list. I think there's close to 1,000 home care agencies in the state of Connecticut that are approved. But yes, you're correct. So once someone does become approved, if the family has a preferred home care agency and they're contracted by the state, we'll go to them first to see if they can meet the individual's needs. Otherwise, yes, we would identify and we would reach out to the home care agency. We would say, okay, Mrs. Smith is looking for Monday, Wednesday, Friday. She needs hands-on assistance. She would ideally like from 12 to 6. Yeah, we do all that. So the individual, we take that off their hands.
So let's end with how I start with you. Okay, let's just go down the road, and you mentioned some paperwork. Who do I connect with to talk about your services, each of you? And what papers do I need to be prepared so I'm prepared for what could be asked of me coming down the road? Now, I know with some of these things there's volumes of paper, but what's the basic kit I need to dig out and have if I'm going to get going? So, Lisa, let's start with you. So
We're
get involved
easy.
with you? Okay, so let's start with that. We'll start with the training wheels.
Yeah, we have a very simple membership application. It's online. We do have a dues. As I said, it's less than $1 a day, but all of our programs are free and all the social functions, the dinners, et cetera. You basically fill out the application and send it in, and you're checked and you're a member. There are some, and it's not a lot of, it's just contact information, emergency information, maybe a little bit here and there, but it's really easy. Sometimes we work with social services for scholarships for our organization, and then it would go through social services and they would approve the scholarship, and then the member would be approved. And once you're approved, we have a member director on our board that sits down with our members, goes through all of the programs, kind of onboarding, and just, kind of briefs everybody of what they need to do, or, if you want to do transportation, this is what you need to do, et cetera. A lot of our members, I will say, as to ease in the program, is that we do have a lot of, we're all volunteers. So a lot of people will come and volunteer and then see what's going on and then decide to be a member. So it's kind of another little backdoor way into it, but our paperwork is really quite simple.
Good. Okay, we'll step up to the next one. So
I get a sense it's going to go up the line.
So
Lauren, for example, you touched on the dial-a-ride, the food pantry, and my senior moment. Yeah, the choices. So if I'm not going to come to you just in an emergency, or if I'm coming to you in an emergency, what should I have at the ready to
Okay.
be,
So
make it
first of all,
possible?
I want to say I have sort of business cards on the back table we changed our email from .org to .gov, so we don't have our new cards yet, but we sort of made some up, so they're back there. All you need to do is pick up the phone and call. And then, depending on what it is someone is asking for, I can get very specific with whoever it is on the phone, what you need to bring. If you're coming for, for Medicare, you need to have set up a My Social Security account. If you're coming to apply for the food pantry, you need to prove that you live in Wilton by bringing a piece of mail that has your address. And if you're applying for financial help, you need to bring some specific financial documents and meet with Stephanie Rowe, who is our director. And if you're applying for SNAP or Medicaid or Husky, there are other documents, and Trinity, who is our specialist with that, will enumerate what it is that you have to bring. We have a lot of we do a lot of help with energy assistance, and all of it's like very clearly written out, and we'll send you an email of what you need to bring for an appointment. It's all, we're not like as bad as the state. It's a lot easier. I also want to say that Trinity, the youth specialist, they also have a once a month tech help program. I think it's on a Tuesday at around 3 o'clock. But anyway, so if people need tech help with phones, with pads, with computers, we have that service available also. But in terms of what you need to bring, it's case by case, and if you just call, we'll tell you over the phone exactly what it is that you need to have with you. We try to keep all of that to very much to a minimum because we're really interested. We're not interested in doing like reams of paper. We're interested in like getting you the help that you need. And a lot of this can be done online, so a lot of documents can now be like uploaded, and I'm not all that good with the tech, but Trinity's great.
So Katie, don't tell me how big a backpack I need.
No,
But give me some
no.
of the what are the basics that we should at least know where they are? The documents.
Sure. Well, I mean, not to be a parrot, but I mean, in our department as well, we try to guide people as best as they can. We do have access to a lot of state programs or databases. So with someone's permission, we can look up and verify their income, so they don't need to bring a bank statement. They don't need to bring certain documentation. But to your point, again, the largest program that the state of Connecticut has, which is the Connecticut Home Care Program for Elders, if you were to apply for that program for your loved one, the state of Connecticut is going to ask for sometimes substantial information. A lot of it is your basic information that hopefully most people have on them or know where they can obtain them. Your Medicare card, if you have Medicaid, a copy of your Medicaid card, your birth certificate, a marriage certificate. Unfortunately, if someone has passed away, they may ask for a death certificate of the deceased loved one. They may ask for a divorce decree. If there's copies of life insurance policies, they will ask to see the cash surrender value of the life insurance policy. Depending on what category you are applying for the home care program, they may just ask for one copy of a most recent bank statement, or yes, if you're applying for Medicaid, they will ask for a 5-year look back period of your bank statements. The DSS workers can request tracers for those bank statements, so they can try as best as you can to try to help your end. But, again, there's various copies of information that the state will ask for, and we will try to work with the individual or the family members to try to obtain that. As you said, a lot of that information can be uploaded. Make sure whenever you apply for state programs that you're never sending the original of anything. Please always make a copy of it. And again, you can work with your local senior center on that, or again, the Agency on Aging will help you. But every program's really different. Other than the Connecticut Home Care Program for Elders, some programs, including the grant programs, those smaller caregiver respite care programs, everything is self-declared. We're trusting that everything that someone is writing down on that application is accurate and true to the best of their knowledge. So same thing with some of the other programs that we coordinate, those private grant programs. Again, we're just asking for the application. That's all we're asking for.
And Katie, a lot of different programs. Am I calling different places for all these programs, or can I reach?
Nope, you're all just calling. Also in the back, this is actually a magnet. So it has our 1-800 number. This is actually a statewide number. So it's 1-800-994-9422. There's, again, these cute little purple magnets back there. It's also listed all over our brochure. I love this 1-800 number because, again, it's statewide. It goes on the prefix of the phone you are calling from. So, again, if you're in this neck of the woods, it would connect you to us in the Bridgeport office because we are your agency on aging. If your cousin is dealing with her aging mother in Hartford, let's say, it will connect you to the Hartford Agency on Aging. When my parents called it, we live in Seymour, it connected them to the New Haven office. Honestly, this is, if you remember nothing else from my presentation, please remember this number because it is information and assistance. We're not for profit. We're not going to try to sell you on any type of insurance, like same as the senior center here. We're just providing you the informed information so that you all can make the sound right decision for your best needs.
Cool. Thank you all very much. Appreciate all of you. You've given us a lot of information tonight and hopefully open some doors. If anybody's got any questions, I'm sure they'd be happy to do them in public, or if you buttonhole them afterwards, I'm sure they can drill down. So. We have some resources. We have people who do that, who advocate within the long-term care. I don't think, with the private insurance, none of these will. Our company, so I can give you a connection afterwards. We have materials in the back, and just take a card. So again, thank you all. I think this is great information. I would suggest two things. One is, now you know these contacts exist. Keep them in the back of your head or activate and engage with them and start the conversation. This is another tool that's in your belt. There are more tools coming. On April 24th, Staying Put, Care in the Home. That's the next session. Sheila O'Brien, who is a certified case manager and registered nurse, will be coming in and be on the panel along with Steve Gregory, a certified aging in place specialist and owner of Oakley Home Access, and Jeffrey Farmer from the Center for Transitional Living. It'll be all the tools you're going to need if you're going to bring in resources to help you stay in the home beyond your local lifelines. So I hope you'll join us in a month. Thank you very much.
Thank you.